Welcome to yet another focus session of the Aviation Foundation. The focus sessions are aimed at informing, inspiring and entertaining African aviation safety. We talk about topical safety issues, make safety exciting hopefully, and speak to safety professionals, either from within Africa or people from outside that have an interesting angle on aviation safety in Africa. Today's session is about work-related stress and mental health. And the reason that the Foundation has entered that domain is that a couple of years back we started doing our first aviation mental health course because we noticed there is a big lacune in that respect, or there's no training at the moment taking place in Africa. So we started a few years ago with that aviation mental health course, and that was the entry for us into that domain. So today's discussion is to look into work-related stress and peer assistance networks. And I'm not here alone. I'm being joined by a number of people around the globe, actually. First of all, if I could ask Joan to introduce herself. Joan?
Hello to the panel and to our viewers. It's my pleasure to join you from Dublin in Ireland. I'm a human factors researcher at the School of Psychology, Trinity College in Dublin in Ireland. And my research is in the area of supporting and managing well-being for pilots and other aviation workers. I'm very interested in well-being culture and advancing solutions that address all dimensions of a person's well-being, particularly looking at psychological well-being.
Thanks so much, Joan, and great to have you here all the way from Dublin in Ireland. Then if I move to the other lady at the table, Tina, welcome.
Thanks, Tom. Hello to everybody again. I am Tina Harris, and I am an associate professor of anthropology at the University of Amsterdam. And I have been working on aviation-related issues for the past 5 years or so.
Great to have you here, and I think also nice for us because anthropology usually is something that's outside our comfort zone, I think. But then again, that's where the magic happens. So great to have you here, Tina. Then to my left, we're being joined by Dr. Lucas Van Gerwen. Lucas, please introduce yourself.
Yes, thanks very much. And hello, team. Yes, I'm Lucas Van Gerwen. I'm an aviation psychologist and also clinical psychologist and psychotherapist. I'm holding a commercial pilot license and an instrument rating, and my main interest is peer support, in which I work for the last 10 years.
Thanks so much, Lucas. Great to have you here. And last but not least, we have on the line from Kigali, from the Aviation Safety Promotion Center, Félicien. Félicien, please introduce yourself.
Thanks, Tom, and hi to everyone in the audience. I'm a clinical psychologist by profession. I coordinate Africa's first Aviation Safety Promotion Center. The center focuses on 3 pillars, which are learning, researching, and experiencing for the pursuit of aviation safety excellency. So we are housed in the University of Rwanda, the School of Engineering. So I have been working for Aviation since 2019 with a focus on understanding human performance for aviation safety. I assist this team and Lucas on developing the research on understanding work-related stress in African aviation. Thank you.
Great, thanks, Félicien. Now that your last words were actually work-related stress, maybe I can go to Jane first and see, Joan, can you explain a bit what is work-related stress and how does it relate to our domain of aviation?
Work-related stress is stress that is caused or made worse by work. So unfortunately, work sometimes causes trouble for people. And really, I like to characterize it as when a person perceives their work, so the tasks that they have to do, or their work environment, in such a way that it contributes to a feeling of not being able to cope. And obviously, that's not a good feeling to have. We all want to be doing well and to cope. One thing I think it's important to understand, and I think why we're looking at it here, is that there's a relationship between our work and our health, and in particular our mental health. And what links our work and our health and mental health is work stress. So depending upon our experience of the work environment, and if there is stress, this can have either positive or negative effect on our health, including our mental health.
Okay, so work-related stress can also have a positive influence on one's performance.
Well, work can have a positive influence, and a certain amount of stress isn't necessarily negative. It can push you on, it can create momentum. It's just having the right balance, I suppose.
Okay, and I think in your introduction you mentioned the fact that you don't just research work-related stress with respect to pilots, because of course we have many other professionals in the safety domain that could be affected by it. Is that something you've seen across the industry?
Absolutely. So we've been conducting research over the last 5 years where we've been measuring levels of well-being for aviation workers. And we started with pilots, but we moved on to include all aviation workers. And actually of most concern in our research is the experience of cabin crew and maintenance engineers. So both experiencing significant degrees of work-related stress, but not necessarily having the same kinds of supports. So for example, I think some of the other panelists will discuss this, but peer support is available in most cases within Europe, for pilots, but not for other aviation workers. So there's a gap there in terms of supports.
Okay. So Lucas, if I take the conversation to you with your background as a commercial pilot, does this resonate with you, the topic of stress? I presume so, but I mean, what's your take on it?
Yes, just to give you an example, not so long ago there was an investigation at Lufthansa Cityliner. Every pilot has to go into the simulator at least twice a year, or sometimes 4 or 6 times a year. But more than 40% of the pilots reported serious stress-related complaints. And that's a pity, because it is work-related, of course, but also your well-being in life. And there are very good therapeutic protocols to help you out with this. So that's just one example. I can give you millions, of course, but just to give you some feedback.
Yeah, okay. Yeah, I think what's also interesting to look at for us as Aviassist is the fact that, in Africa, perhaps there are different forms of stress or different sources of stress, perhaps. Forgive me, I'm not a psychologist myself, so I'm sometimes talking like a lawyer, which is what I am. But we need the research on that topic, and that seems to be lacking in Africa in particular. Tina, that brings me to you in terms of research as an anthropologist. What are the types of research you've been involved in, and how does it link to the topic of stress?
Yes. So I've been doing some of my work in Nepal, amongst various aviation workers in Nepal, looking at stress, especially in areas where there are, say, few resources, to a few technological resources in certain small airports, for instance, and pressure to, for instance, get tourists to certain parts of mountainous Nepal very, very quickly, and of course the environment and the weather, which can be very severe at times, and I'm speaking also for, say, mountainous regions. And so I've noticed, actually, speaking to a number of people who are working quite hard in the aviation industry there, that there are particular stressors that are put into place, and they come from so many different angles. And I think this is something that we might want to look at if we are to do further research in other parts of the world.
Because indeed that's certainly our plan, and we'll speak about it a bit later, that the Aviassist Foundation, assisted by this able team and other players, is going to perform that type of research indeed. One interesting thing I spoke about with Captain Robert Gobak from Rwandair, who's also a medical director and unfortunately couldn't join us today, but that the stress factors in Africa, in his perception, are quite often sometimes very different, which is maybe something also you experienced in Nepal. One of the things he spoke about is the fact that a lot of air crew, but equally cabin crew and engineers in Africa would have experienced things which are unfortunately more common in Africa than they are here. For example, the loss of children at early stages in life, which is luckily very uncommon here, but more common in African settings. Equally, the absence of job security. Of course, if you lose your job in the West, if you like, there is a benefit system in place. But that's not the case in many African places. Is that something you came across in the Nepal research as well?
Not as much, I would say, in certain situations. But I do think job security is an extremely important thing to look at. And I think that there are a number of people who are concerned all across the world, actually, about job security.
Especially now, I guess.
Especially now. And I think one of the issues that came up was also lack of staff, actually, and the fact that more trainings need to be done for a number of people who want want to get into aviation, but of course it takes a very long time. And of course the people who are working are, you know, say there's only 2 or 3 people working in a tower, whereas normally you would have 6 people working at the same time. And that of course creates stress.
So a shortage of skilled labor, basically.
Exactly. In some situations, yes.
Yeah.
It's so true what you say. It's not just a problem, it's around the globe also. Yeah. The difference between the big airliners and the low-cost carriers, it's tremendous. That you get a contract, just a summer contract, not as cabin crew, but also as a pilot. It's it
puts extra stresses on.
Absolutely, yeah.
Now, Joan, I know you've also been involved in research there, isn't it? Yeah, go ahead.
Yeah. Yeah, no, I think there's 2 things I'd like to point out. So there are some stressors that are common to all aviation workers, but particularly in the area of work contracts and the nature and design of work contracts. Some pilots have reasonable protections, but not all pilots do. And we're seeing an increased race to the bottom where you have 0 hours work contracts. And this is becoming more prevalent for pilots, but it has existed for a long time for cabin crew, for ground staff, for maintenance staff, and is often overlooked. Another thing to say is that, you know, as we live in the world, and you brought up the example of, you know, experiencing bereavement because of the loss of a child. So stresses outside work can impact upon our performance in work. And it's not so straightforward that we can say, you know, we're in work and then we're not in work. Our life comes with us, whether it's in work or outside work, we bring it with us. So if you are having, you know, if you have a child who's having health issues, or a family member who's sick, or a family member who is having troubles in their own work, or in terms of maintaining a livelihood, this is something that you experience and you bring with you to work. So a previously manageable work situation, you know, can be made more difficult by stresses outside work. And then certain potentially triggers in the work environment, you know, a more stressful day, additional operational pressure, maybe a very complex flying approach for a pilot in, you know, more difficult operational environmental circumstances. This can be a trigger to, you know, stress and pressure. And that over time can have significant mental health implications.
So we've spoken about the fact that, you know, there is work-related stress in every domain in aviation, in fact, even outside aviation, of course, but Aviasys focuses on aviation, that it can have an effect on the safety of the operations. We've established that stuff that happens in your private life affects your work relationship, your work performance as well. What tools do we have available to provide? So I'm trying to make a bridge to the peer support programs. Mm-hmm. What tools could we think of to help African aviation professionals, in this particular case, deal with those kind of work-related stress? Any idea, Lucas, any suggestions what we could do?
Yes, of course, peer support is just one. It's quite new in some parts of the world, but in Holland we have peer support for already 15 years with the big airliners. But also that mental health is available for pilots as well. And the difference we have, for instance, just to give you a small example, when you have a bird strike and you lose one engine, the personality differences and also your experience difference. For one person says, yeah, I have this exercise
before,
in the simulator 4 times a year, and now I have it in real life, and I love it. So I have it in real life. But for a young pilot, it can be very stressful. So it's there's so many different related things, not in culture, but also in personality,
experience people have, and even their personality, I would imagine, indeed.
Yeah. Absolutely.
So what I mean, we easily say the work peer support, but what would peer support entail? If you think of, for example, KLM or another airline in the Netherlands, how would that peer support work? Is it just a matter of you and I having a drink, basically, or is there? How does it work?
No, there's no drinking involved.
Oh, okay.
Sorry, Tom.
Well, I don't mean alcoholic drinks, but a glass of water.
Yes, there can be a cup of coffee or a glass of water. Okay. The system is set up different, but what EASA wants that after an incident or an accident or just a smaller incident, most of the time is passenger related, passengers dying on board or whatever. Or you have to divert, or there's a TCAS warning, or that you are being called by another pilot who is trained to help you out how to deal with the possible stressors. Just to give you an idea what you can expect, how your body can react, how your mind can react, and to help them out in advance. So give you kind of a roadmap what to expect, and to give them your coping tools how to deal with it. That's the only. So there are just colleagues who help out colleagues. They are not therapists, and they never become therapists. No.
But they have been trained.
They have been trained. Yeah, they have been trained, and they also have the skill that they say, okay, this is above my head. You should be referred to professional healthcare.
Okay, and when you think of that training that these fellow pilots receive, what kind of training, what's in the training, and how long does it last, roughly? Can you give us a picture of that?
Yes, it's about 2 days. It's a 2-day training.
A 2-day training.
Yeah, 2 days, more than 16 hours. And you get it will be repeated every year, sometimes twice a year. But there is also somebody in the background, a professional health, a clinical psychologist or an aviation psychologist. So if you don't know how to deal with it, so you can have a background talk. How can I help this
with a professional?
Yeah.
Okay, so it doesn't necessarily have to be. Well, I guess rocket scientist is not the right word, but it doesn't necessarily require somebody to go for training for 2 months or something, for this initial support at least.
No, you have to. You teach them some tools how to deal with it. But the main thing is, okay, that you open your eyes. Okay, this is something serious. It has to be referred, and then you help somebody out. Okay, to seek real help.
Okay. Well, we'll come to Freddie Shannon in a moment, but first I wanted to take the attention to Tina, because as an anthropologist, I would imagine the type of peer support perhaps that is available here in the Netherlands is geared towards the Dutch professional culture, which I would imagine is completely different, or could be completely different, or at least different than the professional culture in Nepal or in Kenya or Rwanda. And I think what we've been speaking about before this broadcast is that we want to try and perform some research in that area. Yeah. How should we behave in that research? Because you're the anthropologist. What should we not forget about when we shape the research?
Well, I think it's interesting, and I really appreciate that you've brought me on here, because the question is, okay, why bring an anthropologist into this project or these ideas, especially when there are so many excellent psychologists here, working on this. And I think what the value of anthropology is that we really study how people interact within social relationships, and we ask, how do people relate to each other, and how what are the most important social and cultural values people have. And that can actually vary, and of course, even within a Dutch organization, that can vary as well. And I think the methods that we use within anthropology, which is, for lack of a better phrase, usually deep hanging out. So, hanging out with people perhaps in their workplace, with their managers, hanging out, perhaps on the flight deck, in the flight deck, in the air traffic control tower, with gate agents, and seeing basically how everyday lives are how people work in their everyday lives. Because often what happens is that you might give somebody a survey and say, okay, how do you feel, when is your work pressure the worst, or do you have work pressure? And they might just say yes. But there's no, or I feel work pressure during, on one day a week. But actually, if you spend a long time talking to people, you get the anecdotes, and you can actually see what's happening there may not be what they say is actually happening. And then you can start to talk to people about this. And what I like about the peer support groups is that it's really colleague to colleague. And I think that's very important. And I think Felician will probably have some great ideas as to how, we can talk to people at universities throughout Africa to say, okay, well, how are we to do the initial research to see, okay, what do people find useful, important? What do people value?
What values, yeah.
Exactly, and go from there.
Okay, well, that brings us to Felicia then, I guess. A very nice opening for you there, Felicia. Can you tell us a bit about the plans that you and Lucas have made for the research of the Aviation Foundation?
Thanks, Tom. We are bringing on board a number of partners, including the Trinity Dublin College Center for Innovative Human Systems that John represents. Also, we have the Amsterdam University, also the Amsterdam University of Applied Sciences, or the University of Rwanda Center for Mental Health, and other stakeholders to help us out with the research. But also, we will roll out the research in 2 phases. So we have started the feasibility phase, which will inform us if we have to go ahead with the second phase or the actual phase of the research. This focus session is also part of the feasibility phase and the 3 or 4 anonymous interviews we do with the African aviation professionals. Yeah.
Okay, so this focus session is our first reach out, if you like, to Africa to say, please get in touch with us, and you'll find an email later on, whether this is relevant for Africa, and if it is relevant, how should we tailor it? What areas should we perhaps focus on, in the opinion of the African aviation professional? And you also spoke of a number of sessions that we will be holding in Africa to speak to people that work not just in the cockpit crew, but also in other aviation domains. Is that correct? 3 or 4 focus of discussions, if you like?
Yeah.
Okay, so those will be 2 important parts of the research, and then we have to try and bring it all together. I guess what will also be very interesting is can we find a way to get the expertise we need to start this research? And maybe that's, John, where I come to you, because I could imagine that at Trinity you also have experience with involving students and perhaps PhD students in this type of research, because sometimes the expertise of psychologists in Africa may be quite limited in terms of the number of people that we have available for the research. Obviously not the expertise of psychologists, but their availability to us. So, Joan, any suggestions or ideas about how you work with students?
That's right. We can involve graduate students. But one thing I think is very important is that there is a kind of transfer of knowledge and sharing of competencies, so that we can enable, airlines and aviation organizations in Africa to work in this area and build their skills and undertake research themselves, and really foster, a strong well-being culture and positive mental health culture. And do this from the ground up. So as researchers, it's not so simple that we're coming in and, hosting research sessions. We're doing this in a very participatory way. And we know from our own research, looking at wellbeing programs, that one of the key success factors is the inclusion and strong and real genuine participation of workers in these, in terms of the design and the strategizing around the design, the execution and the evaluation of them. So it has to happen with the people and for the people. And, that can be culturally sensitive sometimes. It's not always easy to implement. Across Europe, it can be very complex to implement with organizations, but it has to, organizations themselves have to take ownership over these issues, and learn from each other and share best practices and share what they're doing. One of our challenges in the research is that there's very little evidence as to what really is happening behind the veils in organizations as to managing mental health and well-being. We do have information about how aviation organizations are complying with the regulation, but the regulation is very much on the floor. It's not at the ceiling. It's not even a step above the floor, and it doesn't address positive well-being. So often the conversations are around addressing mental health problems, someone who's suffering, but really we should be starting with looking at positive well-being for everyone, and looking at preventative approaches so that you don't have people suffering, experiencing extreme work-related stress, psychosocial hazards in the work environment, or maybe taking time out of work, which has impacts for them, it has impacts for the family, and it has impacts for society more generally, And
if I just link it back to the point that you were making, Tina, about deep hanging out, I like that word. Is that also something that you've come across, Joan, with that lived experience research that you've done to try and really see what goes on in the life of aviation professionals?
Yeah, so we take, it's a complex term, but it's phenomenology. It's a phenomenological approach. And this is looking at the first person experience. And it requires a lot of deep hanging out, as Tina says. A short conversation, a 20-minute interview isn't really going to give you much depth. It can touch at the surface. So really it involves interviewing over time different aviation workers. And one of the things that we're guided by is looking at the 3 pillars of a person's health and well-being, their physical health, their psychological health, and their social health. And people depending on what grabs them, or, you know, what's of concern in the moment, or what they're experiencing in the moment, may tune into their social wellness or their financial well-being or their mental health, you know, or they may just describe an interaction they've had and that speaks of a certain situation, and then you need to unpack it. And with across different countries in Europe, more globally, we've different ways of handling conversations about our well-being, never mind the sensitive topic of our mental health.
Yeah.
And, you know, it's not something that you can jump right into. You know, if I were just as a person on the street to talk to another individual, if I'm stopping, you know, I would be careful in how I approach, and sensitive and respectful. Nonetheless, you know, you want to support people and learn from people, but it's not something you can say, I have 20 minutes, I'm now going to talk to you and I'm going to get all the answers. And that's it. That's not how it works.
That's not deep hanging out, indeed. and I guess...
No, absolutely not.
I guess, Joan, one thing which I was also curious about, do you involve students in that type of research at your university in Trinity?
Thus far, only graduate students, yes.
Graduate students. And Tina, how is that at Amsterdam University?
Yeah, we do. We have master's students that we work with. We have an applied anthropology program, and we've had students work with Transavia, for instance.
Which is a Dutch operator.
Exactly, with similar topics. But we also have PhD students, but not a specific PhD program on aviation.
Mental health.
Not within the applied sciences, yes. The applied university,
yeah.
Yes, but not within my department.
So I think, Félicien, that might be promising for you because, of course, you're based at the University of Rwanda at our Aviation Safety Promotion Center. And we're going to need lots of people like you, graduate psychologists, you know, perhaps from the Center of Mental Health at the University of Rwanda, to work with us on this. So how does that sound to you, Félicien?
I guess this sounds exciting, so we need to talk with Professor Densastes to assist us with that.
Yeah, because I think what is also very interesting, a discussion we had in another session is, for example, in the selection process of new recruits in an organization, it might be useful to have a psychologist involved. But then the issue that came up is people automatically think it might mean you have to have a full-time psychologist working for you. But of course, you can dip in and out of that type of research if you need it to. And I guess that could be the same when it comes to work-related stress and mental health. That we don't, well, yes, in the ideal situation, every operator would employ a psychologist, perhaps, but that's not realistic. So perhaps working with, you know, somebody whose expertise you can share, and working with students might be an easily accessible way of doing this, of bringing this mental health into the picture. Is that something, because you've worked at Leiden University, of course, for many years?
Yeah.
Did you work with students there or graduate students?
Yes, always. Yes.
Always.
Yeah. But I'm very happy now. I'm not longer at the University of Leiden, but I'm very happy that we have two other universities are joining us. So I have the same excitement as you have. So it's the main thing is that we are increasing the well-being of pilots and get them to know that there is mental help available. So everything we can publish around it and show that it's possible, it's helpful.
And I think what is important as we go towards the closing of this session is that we really start to look in every nookie and corner in Africa to find those people with whom we can have that deep hanging out session, I guess, because you know, as long as we don't hear from Africa, from all the people out there about the needs, whether it is cockpit crew, cabin crew, engineers, then it's going to be very difficult for us to shape this research and make a contribution to aviation safety improvement.
Yeah, and I think what Joan was saying was very, very useful in that, you know, doing this from the ground up is extremely important, you know, and to talk to all aviation workers to get personal stories and experiences of what people see as work-related stressors, you know, and that can be hopefully something from which we can begin to think, okay, what kind of support is needed in which, you know, within which part of aviation, within which group, within, you know, which region in or country in Africa that we're speaking about. And
in that respect, we're very happy. I said, yes, go ahead, Félicien.
Just to react to what Tina says is that we intend to carry out a workshop at the headquarters of a mayor and partner in East Africa. So then the qualitative data we collect from that workshop will help us, or will complement the quantitative data we'll be collecting through a web-based survey that we'll send out to African aviation professionals.
Okay.
Of course, that means we need to develop the study protocol. We need to see whether the mental health tools we'll be using are applicable to the African context. So, yeah, that's my reaction.
Yeah, no, absolutely. I think it's a very fair point. And also the protocol you brought up, Felicia, we have to make sure that the information we gather for the research is being looked after properly so that we don't bring into harm's way the reputation of people, of course, because otherwise they're never going to do our deep hanging out, which is, sorry for being stuck on that word, Tina, that just resonates with me, actually.
But that's,
and Tom, could I just add something just to the conversation, that one of the things that we've learned in our research is that, particularly with pilots and also to an extent with cabin crew, is that they've normalized what is probably best described as a very poor workplace experience, at times. So, and they've normalized low levels of well-being. So they get used to coping with some levels of stress. And there's both a positive and a negative with that. So I think any conversation and any data collected around work-related stress and the experiences of aviation workers in Africa needs also to look at coping and what strategies people take, because that's something to learn from, and needs to put its shape on solutions, as opposed to just looking at it simply to define the problem. And, we have found that there are some coping strategies that are more effective than others. For example, physical exercise, good sleep management. And some people seem to thrive in environments that other people, fall apart in. So just to learn a little bit more about that is useful. And I think that means that there's learning for the people involved in the research as well, and that there's benefits to be shared, as opposed to simply mapping a problem space and just looking at, well, what are the features or the sources of work-related stress that's particular to the African experience, or a particular airline within Africa that is of a particular size or has a certain level of diversity in their workforce.
And I think that's a very important point. You bring it very close to Aviassist as well with that remark, Joan, because in Aviassist, we're not, with all due respect, but interested in academic exercises. We're interested in, bringing something that people can apply that's pragmatic in the circumstances they find in. And of course, yes, we would love to dream up, a full psychological department or aviation mental health department in every operator, but in reality, we have to start somewhere. So that's why we're very pleased that through Dr. Robert Gobak, for example, Rwandair has now said they would love to work with us on this, because I think that's where it starts, them opening up, but them also, like you said, seeing that this is not going to result just in an academic publication in a fancy magazine, but it's also going to give them practical, pragmatic steps that they can apply in their daily operations.
And peer support accessible for everybody in the aviation industry, for pilots, for cabin and cockpit crew.
Yeah. Let's not forget about people outside the cockpit, indeed.
Exactly.
So easy.
Yeah.
Tina, you wanted to make a...
Yeah, I wanted to say that as well, just follow up on what Joan was saying, that the coping strategies I found in my research in both the Netherlands and Nepal are sometimes so creative and very, very, things that are improvisational in a way that actually other groups can learn from as well. And some of them are things that we've never even thought about in terms of coping with work-related pressure. So this is a learning experience for everybody as well.
Absolutely.
Yeah.
And that makes it also very interesting, of course, because it means we're going out of our comfort zone.
Yeah.
Perfect. Well, thanks so much. I think my call is to the audience also, those who are looking and who find it an interesting topic. Please get in touch with us. You'll see our email address displayed. It would be great to hear from you, your ideas, your anecdotes, and whether or not you'd be in for working with us on this. Go for those deep hanging out sessions involving only coffees, not alcoholic drinks, I've learned, which is fine with me.
And water, cheers.
And water. Yeah. So thank you very much to all my panel members today. And again, once again, it's a pity Dr. Robert Kobak couldn't join us, but he's with us in spirit, and he gave us his input last week. With that, we've come to the closing of this session. Please don't forget, we'll have other focus sessions coming on different topics as we delve into the world of safety and safety professionals. Thanks for watching, and see you next time.